Welcome to another video. This one's going to be a pretty quick one. We're going to talk about airway resistance, and then in the next follow-up video, we're going to focus on lung volumes. Okay? So, when it comes to airway resistance, okay, we have to talk about a special law, and we touched on this before in the mechanics of breathing video. So, that law is going to be Poiseuille's law. So, Poiseuille's law, if you guys remember, was going to say that flow equals to, and flow here being airflow, equals to a change in pressure over R. Now, don't confuse this R with radius that was in Laplace's law. This R actually refers to resistance. Okay? Awesome. So flow equals the change in pressure over resistance. Again, we can always draw some sort of relationships here. So we can actually say that pressure, okay, is actually directly proportional to flow. If I increase my pressure, I increase the airflow. Pretty simple, guys. If I decrease the pressure, I decrease the airflow. What else? Well, I can say that resistance, since it's on the denominator, okay, I can say that resistance is actually inversely proportional to my flow. So if my resistance air increases, okay, my resistance to what? To airflow. Guess what? My airflow is going to go down. Okay? And it's the same thing. So if my resistance goes down, my airflow is going to go up. Okay? And we'll give a couple of examples for this so it can really solidify in you guys' heads. Now, here's the thing, guys. Resistance is actually very minuscule when we talk about healthy airways. Okay? It's pretty minuscule, and it's pretty irrelevant in these scenarios because it's normally very low. But it's not non-existent, okay? And in certain scenarios that we'll talk about, it is for sure going to contribute to a lot of factors, okay? So first of all, before we get into it, what actually is going to determine resistance? And then we're going to talk about what influences resistance, okay? These are two different things. So what actually determines resistance? Well, if you look at it, tube length can actually determine resistance, okay? Now, what tube am I referring to here, guys? What, as it refers to the respiratory system, what tube am I referring to? Now, if you're thinking to yourself, okay, he must be talking about the trachea, the bronchus, and the bronchioles, you're absolutely correct. I'm talking about the conducting airways, right? The conducting airways here are going to be the tubes that I'm talking about, the length of those tubes. Now, tell me something. Do we usually worry about this? Probably not, right? Why? Because tube length is usually fixed. Okay, it's usually a fixed thing, right? So after you, finish puberty, usually you're done. Okay, and pretty much, your lungs are not going to get bigger, your airways are not going to get any bigger, right? So tube length is fixed, and we don't really got to focus on that, okay, as a variable for resistance. But it is important when we start comparing, for example, men and women, right? Women usually have smaller lungs due to their smaller just stature in general. And for example, if you take a small guy, right, versus a bigger guy, okay, the bigger guy would obviously have larger lungs, thus larger airway resistance. Okay, so again, it's just big that way. Now, for example, let's take something here. Okay, let's take something here. Let's say that I have one straw. Okay, it is this big. Okay, and I have another straw that is this big, okay? And they're both going to try and pull some, I don't know, smoothie or something, okay? Which one of these do you think, which one of these do you think is going to have the higher resistance, okay? So I'm going to blow and suck into this straw, and I'm going to pretty quickly get something out. But over here, it takes a longer time, okay? So obviously this guy, the second guy, is going to have a higher resistance to airflow, okay, or just flow. Now, what does this tell you? The longer the tube length, the higher the resistance, okay? So that's one of the things that determines resistance. Another thing is going to be interactions, okay? Interactions between gas molecule, which is actually pretty variable, okay? Between gas molecules, okay, and this can determine laminar or turbulent flow, okay, We won't touch on this too much today, okay? But really, really, the thing that is very important when it comes to airway resistance is going to be friction, okay? And that friction actually really arises from airway radius, okay? Airway radius, which is actually highly regulated. And by the way, this right here is by far the biggest contributor to this resistance, okay? By far the biggest contributor. Now, with that said, what actually influences resistance, guys? What influences resistance? A couple of things that influence resistance. So let's take a look at that very, very briefly. So there's going to be a couple of things here. So there's going to be physical factors that influence resistance, and there's going to also be neurological factors. Okay, and I'll put a little asterisk here. Quotations on the neurological, because one of them is not really neurological, but either way. So when we talk about this, what are the two physical things here? Well, the first thing is going to be your transpulmonary pressure. Man, this guy keeps popping up, guys. So what does this mean? It means that it's pretty darn important. Pretty darn important, okay? And for example, let me ask you guys something. During inspiration, okay, is resistance going to be high or low? What do you guys think? Do you guys think that with regards to this transpulmonary pressure, is resistance going to be high or low? Well, as the transpulmonary pressure increases during inspiration, resistance is going to actually go down. Okay, so the resistance goes down. And this is actually because we are increasing the thoracic cavity volume, okay, and we're dilating the alveoli, all right? But it's not always that simple. So if you go back to that compliance curve where we had the lung volume here, and we had the transpulmonary pressure here, or just pressure, you would notice that it was kind of like a sigmoidal curve, right? So at certain times, the lung is going to be more compliant than others. So the lung's compliant here, but it's not very compliant here or here. So over on either of these edges, resistance to airflow is going to be pretty high, okay? So if transpulmonary pressure is too high, then resistance is high. But it's usually around these areas, right, when we breathe. So we're pretty fine, okay? So again, I'm just getting you to kind of understand this concept here, okay? Now, that's that. That's the tidbit with the transpulmonary pressure. The other one that's a little bit physical is mucus accumulation, okay? So you got cells in your airway that actually secrete mucus, okay? And there are certain diseases where you can actually have too much mucus. What's a disease where you can have too much mucus, guys? I know you know it. And if you're yelling out at me saying, hey, Keon, I know the answer, it's chronic bronchitis. You are very much correct. Chronic bronchitis, okay? I'm not going to get into this, but you can basically think of it like this, right? In the last video, I mentioned that chronic bronchitis and emphysema, right? They're pretty much by tobacco smoke, okay? So tobacco smoke is the main sort of contributor to it, okay? And you can think of it like this, right? So here is your airway cells, okay? So here's another airway cell, and then here is like this wonky looking cell, and then back to it again with the airway cells. Boom, 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 boom. This wonky looking cell is going to secrete mucus. Why? Why is it going to do that? Well, it wants to protect you from all this tobacco smoke, okay? So it's going to secrete a thin, nice little lining of mucus to protect you from this tobacco smoke, okay? But over time, this mucus production might get very, very, very high, okay? And it might actually start to block the lumen. What do I mean by that? So let's take a bronchi, okay? And let's slice it here, okay? And then let's look at it from a top-down view. So let's look at it from a top-down view here, okay? So imagine I have a layer of mucus all around this guy. Actually, let's do it like this. Boom. I have a layer of mucus all around this guy. Do you notice how the lumen is so much smaller now? The lumen of this guy is so much smaller than it was previously. Why? Because I have all this mucus buildup. Well, if the lumen, or another way I can say this is the radius, if the radius is super low, what happens, guys? What happens to the resistance? The airway resistance goes up to the airflow. Okay, the airway resistance goes up to the airflow. So that's very, very important. Okay, it's very important. Okay, so that's that. All right. And let me get rid of this drawing. Cool. All right. So that's that little tidbit. Okay, chronic bronchitis is a hypersecretion of mucus. Okay, that's where that's kind of coming from. Now, as with regards to the neurological aspect, with the neurological, we can actually control the size of the actual bronchioles. Okay. Now, for example, we have the parasympathetic nervous system that contributes to this. We have the sympathetic nervous system that contributes to this, and we also have molecules like histamines. Okay, which is not really neurological. I mean, it can be, but not really. Histamine usually is released in scenarios of inflammation. Okay, so for example, if you have asthma, okay, and this is just a random example here, okay, if you have asthma, or better yet, let's say you have allergies. If you have allergies, okay, and let's say to pollen, okay, as a mechanism for your body to protect itself, okay, your body's going to start releasing histamines, right? Certain immune cells will come in and they'll start releasing histamines, okay? And those histamines are going to try and protect you from this allergen. How are they going to do that? Let's come over here. So you guys know that we have different things going on, okay? We have the parasympathetic nervous system that's contributing through airflow, and we have the sympathetic nervous system. But how? Well, first things first. Here, we're going to say is a normal radius, right? Here's a radius, and here's a radius. Here's a normal bronchial radius. Why do I say bronchial? Because if you guys remember your airway anatomy, right? We had the trachea, right? And then we had the bronchus, okay? And then after the bronchus, I would get down to my bronchioles, which would actually be covered by smooth muscle. Okay, so this little red here is smooth muscle. And what do you guys know about smooth muscle? Okay, it's a type of muscle. So it can contract and it can relax. If it contracts, the lumen of this actual bronchiole gets smaller, just like this. If it relaxes, the lumen of the the bronchiole dilates, gets bigger. Okay. Now, if it dilates, we actually give that a special name. We call that bronchodilation, right? Because we're at the level of the bronchioles, and we say that's bronchodilation. If it, contracts these smooth muscle cells, we actually call it bronchoconstriction. So again, I've been teasing you guys a lot. How does the sympathetic, parasympathetic, and histamine play a role here? So the sympathetic nervous system is going to release a couple of neurotransmitters and hormones, including norepinephrine and, actually I'm going to write it down here, norepinephrine and epinephrine, okay? Whereas the parasympathetic nervous system is going to release something like acetylcholine. And you guys remember we said that histamine released in certain times of inflammatory situations, like for example an allergy, okay, or allergic reaction, can also play a role here. So histamine actually causes a bronchoconstriction. So these smooth muscle cells, guys, they're going to react to the presence of histamine and they're going to contract. They're all literally going to contract, and when they contract, they're going to constrict or decrease the lumen of this actual bronchiole. Why would they do that? They're doing that because your body is releasing histamine as a protective mechanism. It doesn't want you to be exposed to that allergen anymore. So what does it want to do? It wants to decrease the size of the airways so that that allergen can no longer come in. Okay? Little does your body know that sometimes it actually makes things worse. Sometimes. Acetylcholine from the parasympathetic nervous system can also do this as well. It can also cause bronchoconstriction. Why? Think about it. The parasympathetic system is referred to as rest and digest. Guys, if I'm in a resting scenario, do I need my airways to be dilated? Do I need a lot of air to come in? Because remember, if my airways are super dilated, is there any resistance? No, right? If my airways are very much dilated, the resistance is very low to airflow. And if the resistance is very low to airflow, what happens? My airflow is super high. But I don't need that at rest. Like I'm just lying on my bed, watching Netflix. I don't need that, guys. So what do? I turn on the parasympathetic, which ever so slightly constricts my airways, which decreases the airflow a little bit. But why? Because it increases the resistance to airflow. Okay? Now, what about norepinephrine and epinephrine? This guy is probably the best example to understand. These guys are released from the sympathetic nervous system. What are they going to do? They're going to dilate the bronchioles. Okay, they're going to cause a bronchodilation effect. Briefly, how do they do this? Again, the smooth muscle cells react to this, and it's basically because they have a specific receptor on them. And this specific receptor, guys, is known as a beta 2 adrenergic receptor. Okay, certain drugs, okay, for example, asthmatic patients, right? You know, asthma is really just a hypersensitivity problem. All right, so your smooth muscle cells in the airways are going to be contracted a lot, right? Meaning you have bronchoconstriction. So one of the treatments that you can give asthma patients is a beta agonist, okay, or a bronchodilator. So you guys had puffers, like bronchodilator puffers, okay? So like salbutamol, for example. Okay, so like salbutamol. These guys are beta agonists, specifically beta 2 agonists. They basically act like norepinephrine and epinephrine, and they bind here, and they actually cause a dilation of the actual airways. Okay, so that's what norepinephrine and epinephrine do. But why do norepinephrine and epinephrine do that? Well, remember, they're being released from the sympathetic nervous system, and the sympathetic nervous system is known as our fight and flight. If a bear just walks in your room right now, what do you want to do? You want to run away. In order to run away, though, you need to activate your muscles, your skeletal muscles. And when they start, getting activated and you start running away from that bear, they require oxygen to function, guys, right? If they require that much oxygen to function, guess what? Where do you get oxygen? From breathing in, right? So I want to dilate my airways so I can breathe in and bring in as much oxygen as possible to my working skeletal muscles. Okay. So that's why I want to do that. Awesome. So this is what's kind of happening here with the bronchoconstriction and the bronchodilation, okay? And people with asthma, one of the treatments can be giving them bronchodilators, okay? Bronchodilators. Another kind of treatment for asthmatics would be, for example, giving them anti-inflammatory drugs, okay? So anti-inflammatory drugs, okay? Why? Because again, it stops, like for example, the release of histamines and stuff, which can actually cause airway constriction. Okay, and this could be things like inhaled corticosteroids. Another one would be giving things like leukotriene inhibitors. Okay, so leukotriene inhibitors. And again, these are just another kind of molecule that basically are involved in asthma pathophysiology and cause the actual. So again, the leukotriene, once it's released, it's going to start promoting inflammation of the airways. Okay, causes swelling, pain, and a whole bunch of different secretions. Okay, so again, that's not what you want. Okay. And you give anti-inflammatory drugs like, inhaled corticosteroids, for example. You can also give, again, these leukotriene inhibitors. Some of them could be things like prednisone. Okay, prednisone, for example, inhibits this process. I'm not going to get into the pathophys of it too much, okay? But that's basically going to be everything for airway resistance. One last thing that I want to mention is, for example, in this scenario, you have a dilated airways, and in this scenario, you have constricted airways. So, for example, air will come in freely here, right? And all of these guys will become ventilated. Over here, air might not be able to freely get in and kind of just like gets trapped along the airway here, okay, because the resistance to airflow is just very high, okay. But that's kind of what I wanted to talk about today, guys. Okay, and in the next video, we'll start talking about lung volumes and spirometry, flow volume loops. Okay, so if you can, again, if you enjoy this video, please like, comment, subscribe. It means a lot to me. And I'll see you in the next one.